Hi there. My name is Monique Caissie, and I'm delighted you could join me today. As a former family life educator and crisis interventionist, I used to create and deliver courses on all types of topics related to family life and to wellness issues. Now, I'm not selling you anything today. Let me tell you why I'm doing this webinar. First of all, I really wanted to figure out the technology. And the second reason is it's because I love demystifying mental illness and other difficult topics people are just avoiding. You know, after 30 years of doing crisis intervention work, the one challenge that I saw time after time was misinformation. Because of the misinformation and a simple lack of dialogue, people just ended up freezing or avoiding things they needed to face. So I thought I'd shine a light on different things that I've learned over the years, and I'm going to offer them in some webinar conversations, I guess we'll call them, throughout this year. And this first topic is very near and dear to my heart. I am honest in saying that I'm a caregiver for my mother who suffers from bipolar disorder. And at a very young age, I was witness to some psychotic breaks, and I became very involved in her recovery. In fact, when I was in high school as a teenager, I quit school just so I could go to the hospital every day, and I really wanted to help. Eventually, I became a counselor. I started working with families and friends and loved ones of people who suffered from all types of mental health issues, and whether they were diagnosed or not diagnosed. And I also worked with people who were suffering and recovering from these challenging illnesses. So my experience has been both on a personal point and a professional one. I'm going to go through today the most powerful program I've ever seen called the L.E.A.P system. It's powerful because it's simple and it packs a punch. L.E.A.P, L-E-A-P, is the acronym. I learned it while I was a counselor. Honestly, this works for people who are even just excessively stressed, not necessarily suffering from a psychosis, and they're just not at their very best. People who are substance abusers and in a different level of dementia, or just your crazy teenagers. This is a very powerful and practical approach to communicating with someone who may need help, but just doesn't know it. I'm going to present the information, and I do invite you to take notes, but I will give you an opportunity to get some crib notes at the end. I have a quick evaluation of my webinar, and in the thank you section of that feedback form, there's a link up to the basic information, the headings that I'm covering here. I'll also be sharing with you the PowerPoint that I've created. So after this is all over, I hope our relationship doesn't end. The one thing I would love to ask you to do is that if you can think of a company or an organization that can use my services, either as a speaker or a trainer or even as a consultant that comes in and has these type of conversations, I'd really appreciate some breadcrumbs towards those potential clients. I promise you I'm not a pushy salesperson. I'm really just looking for people who can use my help. So today, I'm hoping this will be helpful. Basically, I'm going to try and condense 225 pages of information from a book into a 25 or 30-minute webinar, so hang on to your hat. So the stigma on mental health or mental illness has many myths. And the main myth about psychosis is that people who can't see that there's something wrong are actually in denial, but it's not true. It's not so much denial as it is a lack of insight. I want to share one of my earlier clients. I was encouraging her. I'd helped her hospitalize her adult daughter. She was in the psychiatric wing of our local hospital. And I said, go and visit your daughter. And I said, don't talk to her about her psychosis, just be there for her. And I gave her some instructions. So she comes back the next time and she says, oh my God, it blew my mind. She was sitting talking to her daughter, and there was an empty chair, and her daughter was talking to mom and talking to the empty chair as though there was someone there. And the mother just decided to do what I had said and pretend that that was normal. And eventually, and so all of a sudden this man came out of his room, and the daughter stopped talking, and she whispers to her mom, and she says, look at him, Mom. And the man is just talking to himself, talking to someone who isn't there. She says, look, he's talking like there's someone there. There's nobody there, Mom. I think there's something wrong with him. So you can just imagine, she could see that he was not well. And actually, people with poor insight into their own illness often are excellent at diagnosing the same illness in others. So if you're sick, maybe you're thinking it's other people, but it's really you. Poor insight in people with a serious mental disorder is actually a consequence of a damaged brain. And the fact that the circuitry in our brain is responsible for recording and updating self-concept is not working properly in such patients, and that's what's causing the problem. For example, take beliefs in myself. I am a married woman. I work at, if you told me I wasn't married, I wouldn't believe you. I work as a speaker, a coach, a consultant. I also sing in a choir. I also have a self-concept about my abilities. In fact, I think I can hold down a job, and if I went back to school, I believe from history, I would be a very competent student. And I believe I have the education and experience to be a counselor. And I think I'm generally socially appropriate when I interact with others. So we all have beliefs. And what do you believe about yourself? I mean, you have beliefs about your own abilities, and I'm going to assume that you have skills and abilities. Do you believe, for example, that you can hold down a job? I'm going to assume that you can. What if I came up to you and said, well, actually, you're wrong. You're actually incapable of working. You might never be able to go back to work unless you took some pills I have for you. Oh, and by the way, you might have to take those pills for a very long time, or possibly even the rest of your life. What would you say to that? And if I started involving other people, including relatives, doctors, you might start to feel persecuted and frightened. That's what we're working against. Basically, when someone is suffering from a psychosis, we are working against what people know to be true about their past selves, without being aware that there may be some neurological issues at play. I wanted to give you a real life example. There was a fellow by the name of George who had suffered a stroke, and he used to be quite the painter, quite, good at art. So his neurologist asked him, gave him a picture of a clock and said, can you draw this clock? And George said, of course I can. So he drew the clock, and he proudly gave it back to the doctor. And he was very proud of his work. And the doctor said, showed it back to him and said, what do you think? And George went, hey, where's the one I drew? That's not what I drew. He was operating under the beliefs that were linked to his past self rather than to his current abilities. There's also a very popular clinical tale about an incredible musician that has been written about. To maintain his anonymity, he is called Dr. P. And I'm just going to read this really quick here. He saw faces where there were no faces to see. Just like Magoo, Mr. Magoo, when in the street, he might pat the heads of water hydrants and parking meters, taking these to be the heads of children, and be astounded when they did not reply. After an exam at one point, he seemed to think that he had done rather well. There was a hint of a smile on his face. He also appeared to have decided that the examination with the doctor was over, and he started to look around for his hat. He reached out his hand, and he took hold of his wife's head, tried to lift it off to put it on. He had apparently mistaken his wife for a hat. And this condition is called Anosognosia, means without knowledge of disease. And poor insight is actually a manifestation of the illness itself. If someone has schizophrenia, not being able to understand they have schizophrenia is actually one of the symptoms. And when we think of someone in denial, they're actually exhibiting a coping strategy. I deny this is a problem because I can't deal with it. So it's a part of the disease. So how can you tell the difference if you're in denial, when it's not denial, and when it's actually a lack of insight? Well, when it's a lack of insight, it is severe and persistent. It lasts for months or years. It also, the belief, I'm not sick, I don't have any symptoms, They're fixed. They don't change even after a person is confronted with overwhelming evidence that they are wrong. They have these illogical explanations or confabulations that attempt to explain away the evidence of illness. For people who are unaware of a serious mental illness or their lack of abilities to function in the world, the traditional approach of trying to convince them rarely works. So what we need to do, if we want to increase the chances that they will go to the doctor or stay in long-term treatment or even just be compliant with their medication, we need to go from an adversarial relationship into an alliance where they feel respected. The mom I talked about at the beginning thought that I was crazy when I was saying just pretend everything's okay. But her daughter wanted a relationship with her. And so we need to speak to the things that the daughter wants or the person wants, in this case, a relationship. They may value their job and want to keep it or want to perform well at their work. So it takes a focused effort, but it's not hard to do when we learn the main lessons. The hardest part is putting aside your own preconceptions and remembering that no amount of arguing has previously changed your person's opinion about being mentally ill or less capable than they imagine they are. So stop trying to convince them they're ill. Instead, the first step is to stop arguing and start listening to your loved one in a way that respects their point of view, including their delusional ideas and the belief that they are not sick. To this end, Dr. Xavier Amador, a brilliant psychiatrist, created the L.E.A.P method, L-E.A.P. It stands for listen, empathize, agree, and partner. And the first one, L, listen, is a special type of listening. It's called reflexive listening. And there's 7 elements to reflective listening. So we need to be in the moment with curiosity and respect. And this is how we do it. First, we make it safe for the person. And we need to know our fears. We need to stop pushing our own agenda. We need to let it be, respect what we're hearing, and find a workable problem. And then we need to know how to write the headlines. So what is the first one? Making it safe. This is especially important if it's been a little loaded. So for example, if things have been really tight, you need to express that you're sorry. You have to say, I'm sorry for not listening to you. I understand that you don't want to talk about this anymore. And then set a special time aside to just be their friend. Go for a cup of coffee, go for a walk, and go sit on top of a Ferris wheel with them. But apologize and mean it. Apologize for the past and normalize the reactions by saying something like, if I were in your shoes, I would feel the same way. And then promise to listen more. I want to hear more about why you don't want to take the medication anymore. I promise I'm just going to listen and try to get a better understanding of your view. I promise not to give you my opinion. So make it safe. You know, advice is a funny thing. When we start hearing advice, I used to work with women, and they used to complain all the time when they have little kids and they say, I get unsolicited advice for how to raise my child. This is my 3rd one. Sometimes it's humorous. Usually it's just irritating. The second element of reflective listening is you have to know your own fears. You know, we all come in different sizes and shapes, but we are impacted when someone we love or that we value is sick. That part we can identify. We all know that we want to help that person who we think is in denial. So we need to realize our own fear that we have of taking that first step. This fear of, what if I make it worse if I listen the way Monique is telling me to do right now? So for example, what I'm telling you to do is just reflect exactly what they're saying. If someone says, look, I'm not sick, there's nothing wrong with me, I'm not taking medicine because it will kill me, it is poison. If you really want to help me with the people upstairs. Now, if you do reflect back what the person said, you would say what they said. You would say, so there's nothing wrong with you, that you're not going to take the medicine because it will kill you. It's poison. You want help with the people upstairs. Did I get that right? But instead, we hear what they say and we're more likely to respond with a question. So what about the people upstairs? Now we've opened up a whole can of worms. They're going to start going. Every night at 8 o'clock, they walk across the floor of the apartment to the bathroom. I hear them flush. They flush the toilet, and I know what they're doing. I am no fool. They're communicating with a group that is trying to kick me out of my apartment. These are the same people who have been trying to kill me. So we all make this mistake. We avoid repeating those initial first details, word for word, but we need to do it. We are worried about reinforcing the denial. But when you're facing someone's rigid rationale, you are not gaining anything by trying to convince them otherwise. So we need to listen to what they're saying and repeat it as they have said it. So we need to also stop pushing our agenda. So that means you only have one agenda, and that is you have the desire to listen and to learn at what they're going through. You don't pontificate, and there's no shoulding. So this, you should do this, you should do that. No shoulding. Don't should on people. It's a good idea to never do that, even if they're well. So this is about letting go of your need to be right and to feel heard. So remember, we're still in the first step. We're still learning to listen reflectively. And that means we have to let it be. Don't react. If the discussion turns into an argument and you're starting to feel that old denial dance coming on, you have to stop yourself. If they start saying to you, you don't care about me, all you're thinking about is yourself and what you want. Well, they're not well, and it can be sometimes difficult for them to follow another person's train of thought. So listen for the feelings behind the words and just reflect back their emotions. For example, you could say, you sound really upset. I get the feeling you're feeling pressured. Discover what that person cares about most and what motivates them. And then respect what you've heard. Reflect it back with a comment or criticism. Don't react. Just be very curious and listen. Memorize this phrase. Write it down. Let me see if I got this right. And then repeat what they said. Let me see if I got this right. So the people upstairs, and just repeat what they said. Think of it this way. Would you really be interested in hearing the opinion of someone who's been arguing with you instead of respectfully listening to your views and making sure they understand you? I don't think so. The next thing you want to do is find a workable problem. Deal with something that they think is a problem. So although someone might not agree that they're sick, there are consequences that they're trying to avoid. So figuring out what those consequences or problems that they might see is your starting point. You're going to be powerless unless you understand what they think is wrong and what they think needs to change. So they may not agree that they have an illness, but they will agree that they hate going to the hospital. And then write the headlines. So you have to approach your conversations the way a journalist would. You don't inject your criticism or your opinions, but you're looking for a theme and you figure out what the headlines are. I'm going to encourage you to actually write what it is that they're saying so that you both know you're on the same page about what's important to them. You need to be in agreement with them. So agree to work on the problems as they agreed. And you can even both sign that if you want. Remember, this isn't a life sentence. You're just finding a small problem you both can agree on working and what it is that you can do to help. When I was a counselor, I would meet with a family in crisis. They would often talk, usually for the first time would be like an hour and a half, sometimes even 2 hours. And I would be just writing a bunch of notes. Then I would repeat back to them what they said, and I could even fit it on a Post-it note. I just went for the headlines. They felt so very heard when I could feed back the highlights to them. So just to recap, listening, of course, is the biggest part of L.E.A.P. And to listen reflectively, we need to make it safe. We need to know our own fears, stop pushing our agenda. We need to let it be, respect what we're hearing, find a workable problem, and we need to figure out the headlines. Now, there is a danger to reflective listening. So what if they start believing that you agree with their delusions? And that's our fear, right? So the delaying tool is to delay giving your opinion about a controversial topic. So it sounds like, I promise I will tell you whether I think you're sick, but first, if it's okay with you, blah, 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 So basically, it's a delaying tactic. And there's 3 A words. The first A is we need to apologize. So before I tell you what I think about this, I want to apologize in advance because I think it might feel hurtful for disappointing you. Don't use the word but. Replace anything you're saying with and, not but. The second A word is to acknowledge. Acknowledge that you could be wrong. I'm not infallible. I don't know everything. I could be wrong. And the third A word is we're going to agree that we might disagree. In other words, you're going to be indicating that you can respect what they believe, but that you're asking them to respect you too. So here's an example of all 3. They ask, do you think I should go to the doctor? They don't want to hear it. I'm sorry, when it's finally time to say it. I'm sorry I feel like that. I feel this way, so that's your apology. And I could be wrong, acknowledge. I just hope that we can agree to disagree on this. Yes, I think that going to the doctor is important. I think they may have information you don't have. The point about this delaying tactic and everything we're talking about is there's a lot of humility. We don't know everything, and we are just asking them to be open to discovering it with you. Now, if you do just the L of the LEAP program and you listen reflectively, you will make huge changes. But there's still 3 others. E is for empathize. Now, people are more worried about empathizing with negative feelings, such as anger. So they're angry. Others want them to go to the doctor, that they will want to take the medicine. And we need to empathize with those angry emotions because empathizing with that is what empathy is. So here's an example from Dr. Amador's book for someone he was examining who had been brought to the hospital against their will. Doctor says, so if I understand you correctly, your mother has been poisoning your soup. Is that right? Patient says, yeah. The doctor says, how do you feel about that? And the patient says, are you serious? How would you feel? And the doctor says, feel? Well, I think anyone would feel scared and angry. And the patient says, so you believe me? Are you going to do something about this? Now, Dr. Amador didn't answer him. He delayed it. We do need to stay in the moment, remain respectful and curious. And here is some examples and samples on how you can delay in an empathetic way. The first one, I promise you I will answer your question, but if it's okay with you, I want to wait and to listen to you more first, okay? The second one, I will tell you, but I would rather keep listening to your views on this because I'm learning a lot about you that I didn't know. Can I tell you later what I think? And the third one would be, your opinion is the most important opinion in this room, not mine. So I would like to learn more about what you think before I tell you what I think. Is that all right with you? It's helpful to let them ask your opinion several times. If they ask for it several times, then they feel that they're responsible for having asked it. So delay and then use apologize, acknowledge, and agree to disagree to show empathy. The A is for agree. Now, people will think this takes too long, but I just want you to think about how long, all the time you've wasted by not agreeing with them. So don't go into diagnosing their condition, just talk about the symptoms. What's going on? What are they experiencing? So if they say, for example, I'm constantly on guard at night, and tonight I'm so afraid they're going to come and hurt me. Now, these describe insomnia, paranoia, and they could be stemming from a delusion. We're not going to use those words. They don't come into the discussion. It's very important that you just normalize their situation. So memorize this sentence. I've said it before, I'm going to say it again. I would feel the same if I were in your shoes. So check and make sure that you're in agreement. Ask them, did I get you right? Did I answer your question about what my opinion is about going to the doctor? When you agree on stuff, write it down. People who aren't well benefit from seeing it written down. So give them a copy. It can really help them to remember. P is for partnering. Try to agree on goals that are obviously reachable, but don't limit yourself to those. And don't try to resolve everything in one sitting. That would be crazy. Find the things that you guys can work on together. For example, my mother goes for shock treatment every month to keep her stable. Every time I bring her in, she's convinced she will die. She hasn't died yet, but she still convinces herself. She doesn't remember how sick she has been. It's taken several years, and I've had to strike an agreement every month, and we've agreed that I would pray with her before the treatment, because when she's anxious, she worries about not being able to pray. I also stay longer with her than other patients in the outpatients. I've had an agreement with the hospital. So I'm her partner because we both agree that this treatment needs to happen to avoid another long hospitalization, even though she no longer remembers them. To be truthful, being in the room as much as I am or praying with her, none of these things are adding to her treatment except in her head. But she saw those as problems. The ones that we agreed on to avoid being in the hospital for weeks or a month is a goal that we both agreed on and we partnered on. And we're always renegotiating these little problems. And I'm reminding her of why we agreed to do this. The thing is that when we get a handle on psychosis, it can be a one-time thing or it can be recurrent. Either way, mental illnesses ebbs and flows, just like our moods ebb and flow. At one point with my mom, taking medication, she was symptom-free for 13 years. Do you know that's longer than how people hold down a job? So this can work. Now, I knew someone that I intervened with at one point who was very angry at me for doing so. The stigma of potentially needing a psychiatrist really bothered this person. And the truth is that mental illness is actually a physical illness. They didn't agree with me. All the medical books, though, still consider the brain as an organ in the body, but we have over-stigmatized it. Like there's a difference between someone who has heart disease or cancer or a brain disorder that impacts the quality of their life and needs treatment, but they're all illness. So when having to talk to people about their new diagnosis of their own or a loved one's, I offered refer to a computer. Because, we've all experienced when our computer goes all wonky and we need to reboot it. Well, a psychotic brain where all the neurons have got all wonky and they're overfiring or misfiring, it also needs to be rebooted. And the reboot is what a hospitalization is and medication is. So the longer treatment is avoided, the more damage. So I still think I'd rather err on the side of caution and know that I'm not letting someone's brain misfire so much that they end up with permanent brain damage just to avoid upsetting them. It's funny how people will fix their computer or call a computer technician much sooner than go for a medical assessment. And when it's about a mental illness, well, that's even harder. And that's why we need to know how to talk to them to get them to go quickly. Medication is not the only thing that keeps our brain healthy. More and more people are realizing how mindfulness, proper eating, and sleeping are all part of a healthy brain, as are having healthy work environments, healthy relationships. These are all very proactive. And just like someone with a heart attack is at more risk, so is someone who has experienced a psychosis. It's always better to do preventative work and to react sooner than later if we see something is going on with someone we care about. If we're wrong, we can always apologize, acknowledge, and agree. And even if they're not sick, but just mad at us. In fact, this communication tool is so good no matter what the circumstances. For example, I did a ride along with a police team one night. I was only supposed to observe and be silent. And at one point, there was a runaway we were trying to find. I was shocked at how one of the police officers wanted to diagnose and label everything instead of listening to the parents. Eventually, the girl came home and her dad brought her to the police station. Although this had nothing to do with psychosis, we were dealing with a strong impasse here. So, even though I was supposed to stay silent, I intervened using a lot of the L.E.A.P system. All I did was listen to her and say, well, if I didn't feel that anyone was listening to me, I'd be pretty stubborn too. And I still remember her laughing, and she started telling me everything that had happened that night. And then we were finally able to agree that if she had kids, she wouldn't want them to do what she had done that night. And she also agreed that she didn't want her parents to be worrying unnecessarily. So we were able to reach an agreement because we all agreed that she should be safe and her parents shouldn't be up all night. Now, as for the cop, you know, the one with the difficulty labeling, well, we had an interesting supper hour about how he felt unsupported and unheard in this precinct. That was just for me, just chit-chatting and asking him how he's doing. Trying to get this testosterone-filled guy to listen to the parent or the girl was so hard. And then I reflected back as we were talking about how hard it must be to be vigilant without going overboard because of this lack of safety that he felt in his job. He started talking about some problems that he could recognize, and he even decided on some of the things he could say to himself to stay in the moment instead of getting overheated under certain circumstances. So this made the rest of the shift much easier on him and also on all of those that engaged. His partner at the end of the night asked me what we had talked about because after supper, he had become so agreeable. I'm telling you, this listening, empathizing, and agreeing works. So I just wanted to share with you, I want some ways that I can help. If you're an organization or you're working for a company, these are some of the things that I like to work with. One of them is the Ask for What You Want program, which if you're in this webinar, it means you have received that free handout and the explanation as to how that works. I also love to go in and I have a keynote on Can't We Just Get Along? And that's all about how to go from conflict to collaboration. I also do trainings on that. And the last program is the one that this is about, which is when I'm talking about the taboo topics. And I'm going to be doing more of them this year. This is just my first one, as I said. So if I can come in and facilitate an organization, a conversation for an organization so that they can make changes that will help their employees or their members, these are all things I really enjoy doing. And of course, you know, I can help people who just want to do some one-on-one coaching. I'm actually just about to open up a couple of spots on coaching in the next couple of weeks. I'm thinking there's going to be about 3 spots, maybe 4. So if you know someone who thinks they're ready to have more confident conversations, improve their professional relationships, I would love an introduction to these people. Now, I'm going to be sending you a questionnaire. And on that questionnaire, at the end of it, there's a link to some crib notes to basically the main themes on these pages. So I really believe that information is transformative, and I'd really love to hear what you have learned from this program and if there's anything I should be adding. So I do hope you have enjoyed the information that I've shared, and that you do give me any feedback or questions. I'd love to hear from you. So this has been the webinar on how to communicate with someone who may be suffering from a psychosis. I do hope that you've enjoyed it and that we have an opportunity to be together again on a different webinar. Thank you, and don't hesitate to reach out with any questions. Take care.